This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Well, in case you didn't notice, we're having a heat wave, and for the next hour, it's a health wave. All right? We're going to put it in perspective for you. Good to have you with us, as always. It's Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT, and, of course, Health Watch features Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We will discuss the who, what, when, where, why, and how of Innovative Medical Associates throughout the course of the program. And, of course, if you have a particular medical challenge and you're not sure whether Dr. Molly and her staff can help you or not, well, that's the time to pick up the phone and call 855-839-1210, 855-839-1210. It is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. And as always, Dr. Molly, even though it's a heat wave, you got to be careful with the health.
Right.
You know?
Everybody better stay hydrated.
Right.
That's my word of the day. Hydration, folks.
And speaking of, the other day, I was invited to Eagles training camp.
Oh, how cool was that?
That was cool.
Yeah.
Right before I came to see you. All right.
Wow.
And I tell you what, I was in the shade.
Right.
And it was like, what was it, 90-some degrees?
Oh, yeah, 96, something
and
like that.
I come into your place, and I told one of your nurses, I said, I don't feel so good. I feel like lightheaded, nauseous, blah, 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 blah. Hook up the IV, gone.
Yeah, you know what? You were out there. Gosh, I'm sure you were sweating, John.
Yeah.
And see, the thing about it is, as we get a little older, we don't always know that we're dehydrated. We don't feel it. You think you're out there, you're not. You say, oh, geez, I'm not really feeling the heat. Then all of a sudden it hits you. And so I'm telling everyone out there, please, please stay hydrated through this thing. It's important.
Good point. Talk about Innovative Medical, and that was an example of what you do, because if I hadn't come in to see you that day, I mean, who knows what would have happened. But
you probably would have been admitted to the hospital ER, and you would have gotten an IV.
Okay. Which
so
is what I got with you.
So you bypassed a whole lot of challenges, let's put it that way, right?
Yes.
So, John, that Innovative Medical Associates is really a cooperative of like-minded healthcare practitioners who can do anything that you can get done by a urgent care within most reasons. No radiology on premises, but if you came in, we can pretty much patch you up, and we can do everything that a primary care office can do. But the difference is the philosophy. We would like to really help people by using the least amount of pharmaceuticals to correct the challenge, to keep the patient stable, to keep the patient, not put them in harm's way. And we do that by augmenting or cooperating with natural products as well as the pharmaceuticals.
So in a sense, what you do is you kind of take the place, in some cases, of a prescription med.
We try to,
okay,
yes.
you try
if
to.
we can.
Yeah. So it's, I guess it's better in the sense that side effects aren't there.
Exactly. The side effects are the biggest thing. Lots of our patients come in and they're having such a hard time on their medication, and they think sometimes it's related to their condition, and in the end you see that it's really related to the pharmaceutical. Maybe they need a switch, maybe they need a dose adjustment, that kind of thing. And we can help do all that by augmenting with the natural substances. And I think we do it better because of the manner in which we do it, through the hydration.
Many patients seem to want to know, and I guess you do kind of explain it, but much of what you do is proprietary.
The synergistic things that we do are proprietary. In other words, I may put two nutraceuticals together in a blend. That's my blend, right?
Right.
Okay? It's like Coke, as you like to put it.
Yeah.
Right?
It's like your recipe.
It's our recipe.
For your cake.
Right. But knowing that each patient is an individual, and they come to me with individual challenges. You know, we have individual genetic makeup, all of us. That's how we are built. And so when I'm thinking about putting together a recipe for a particular patient, I'm thinking about some of the testing that we've done. I'm thinking about their qualitative information that they've given me as to why they're coming. And I'm looking at data that's out there that says this particular nutraceutical may help support in that case. So help support the patient get through their particular challenge.
And your hydration is how you deliver it.
That's right. Right. It's not the only way, but it's the most effective way.
Exactly. And that's kind of the cornerstone
sure.
of the practice.
Right.
But how many times do people come in and
sure?
But give us an idea.
John, you've been a lifer. You've been in once a week since you and I were kids.
Now it's twice.
Yeah, I know. Well, why? Because we have an additional little problem that's
right.
popped up. But, you know, the bottom line is, like I like to say, listen, I don't want people to have to go steady with me, but I want to effectuate the change of their challenge. And what happens for the most part, when I get people who come in with chronic conditions, it seems that they need to come in a couple of times a month after an initial treatment protocol. And a treatment protocol may go from 10 treatments to 30 or 40 treatments, depending on the severity of the condition and what it is we need to accomplish.
Well, some of them do it quickly, like they'll go through your treatments and you'll say, gee, that
you're good.
You're good now. But some of them take a little longer,
right,
depending on the situation.
Again, it's individual, and it depends on what. When we're talking about cancer supportive therapies, we got to talk long term. But when we're talking about people who come in, let's say for an environmental detox, which we'll talk about today, it may be a series of 15 treatments. They're done. We've removed the particular problem element, and now it's a question of them maintaining their health. So they may come back once a month or twice a month for whatever.
And neurodegenerative, that's another big category.
Yeah,
right?
I'm really MS. I just started a new MS patient who actually the husband listens to this program. He's a pharmacist. And this is going to be a very interesting case, and I'm looking forward to following up with her.
In general, do you find that people come in initially and maybe, let's say, 10, 15, 20 treatments?
Sure.
Then maybe they'll stop. Then they'll come back.
Sure.
It's kind of like a maintenance on your car. You get your oil changed every 6 months.
Right. And the thing is, what I find is that patients who are in tune with their challenge and they see the progress that they've made. They see the progress that they made. They don't want to go back. And it can happen, right? It can happen, and we'll talk about that in terms of environment when we come back.
Why is it, and I've asked you this many times on the radio, why is it that we're not really in tune with what you do? A lot of people, like, they're so used to prescription meds and all the advertisements.
That's one thing. And I think the other thing is, I think the evolution of all of these spas has sort of dumbed down what they think I do.
Yes.
And you know what? No, this isn't a place. This isn't a place where you get your hair cut. You know, this isn't the place where you're going to, come in and sit in the whatever, the sauna room or whatever, or go for a swim in the pool. No. This is truly a medical kind of facility.
You know, it's interesting. Every weekend, watch TV.
Yes.
There's another new prescription.
Oh, that's
commercial.
a whole other issue.
I mean,
right.
It's like how many things are they coming out with?
Listen, Big Pharma never sleeps. That's my thing. Big Pharma never sleeps. And because people in our country have been so programmed to go grab a pill for every single situation, that it's just ever evolving. And I'm going to tell you, I see people come in with bushels loads of pharmaceuticals, and then I see them come in with bushel loads of natural substances. And believe it or not, some of the natural substances are doing a problem with this nutrient. It's just insane.
Absolutely. We are coming up on our first break of the morning. Our program is called Health Watch, and you'll find us here every Sunday, the live version from 8 till 9 here on Talk Radio 1210 WPH.D. 855-839-1210 is our number here in the studio, and we always tell you at this point in the show, you call early because we can make sure we can get your call in, and Dr. Molly can take some time to discuss your situation. So if you have a question, a medical challenge, anything, 855-839-1210, 855-839-1210 with Dr. Molly Fantasia. I'm your host, John DeMasi. More of today's edition of Health Watch after these words. Hi, it's John DeMasi, host of Health Watch, heard every Sunday morning 8 till 9 and again from 4 till 5 here on Talk Radio 1210. Is chronic pain or fatigue making it difficult for you, or maybe someone you know, to enjoy simple pleasures like walking your dog or spending time with the grandkids? Dr. Molly Fantasia and the healthcare team at Innovative Medical Associates offer medical hydration therapy. Their autoimmune therapy program has helped hundreds of patients to feel better and do more.
We can bring a patient to a better quality of life and then a healthier approach to their entire condition.
Visit innovativemedicalassociates.com to learn more about their autoimmune therapy program. Join me and Dr. Molly Sundays, Health Watch, 8 till 9 and again 4 till 5 here on Talk Radio 1210. And we're back here on Health Watch. Operator standing by right now at Innovative Medical Associates. And if you have some questions or you want to really sit down with Dr. Molly and go over your particular situation, you call that number now, 856-489-0505, 856-489-0505. That's the number. You call, you make an appointment to sit down with Dr. Molly. And remember, the initial consultation is complimentary, about 20 minutes or so. It's more like or so than 20 minutes.
I would say.
856-489-0505. Check out the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. A lot of good information on that as well, and it is constantly updated. So if you saw it last week, might be some different things on it this week. Again, innovativemedicalassociates.com is the website. And our show is Health Watch, and you'll find us here every Sunday, our live version, 8 till 9, Talk Radio 1210 WPHT. The number here in the studio, 855-839-1210. And I know, Dr. Molly, you have some folks coming in from out of town.
Yeah.
And this is a big week for you as far as environmental issues.
Yes, this is pretty interesting, John, because environmental medicine is something I've always been interested in. Because when you look at how the environment can have an effect on the physiology of the body, and you've got to realize that everybody is genetically an individual. So that's how it really ties into what I do. So I look at this and I say, okay, why does somebody, with it, looking at their history, when you get the qualitative data from a patient, you find out what they did, this kind of thing, you can see that various pollutants, even at a low level, that's the fascinating thing, even low-level exposures can cause the body to go into some type of crisis. And what does it all start with? Inflammation, my favorite topic. And so I look at this, and it's funny. Treatment is really relevant for a clinic like mine because generally we need to use chelators or things that claw out these toxins even at a low level, John, at a low level. And I'm going to tell you that I proved it to myself this week. I was using denatured alcohol based on what one of my patients told me to use on some teak wood that I had, teak shelving that I had in my co-op. And I started using it, and I realized the fumes were intense, and I could feel the cloud in my mind. And I said, God, can you imagine if somebody's using this day in and day out? And I started thinking about this, and I said, I can't wait for me to get into the office tomorrow and start some chelation. I certainly feel better having taken all my supplements, but I know that these types of pollutants have an effect on the body, and in particular, the neurodegenerative, the cancer support, people with heavy metal toxicity. And these translate into all kinds of issues, as in medical issues, whether it's the clotting issues, in terms of people having super clotting and maybe having a stroke. Actually treated somebody once who hurt themselves with a stun gun. Jeez. And ended up having a stroke. I've seen it using chemicals. I've seen it with the farmers who are coming in this week. That's another reason why I was thinking about this. You know, the pollutants from the fertilizers and the various chemicals that they spray. So we need to look at this in its totality. In other words, just because you eat organic and you really limit your exposures, you're let's say an at-home mom, or you're an executive and you think, well, I don't have these exposures with the toxic chemicals. Guess what? You do, because these pollutants are in our air, they're in our water, they're in our food, and I want people to pay attention to this. And these pollutants act differently on various organs in our body and various systems. For example, there are some particular sprays that are used for herbicides that can actually have an estrogen-like effect on the body. People don't know it. They're called xenoestrogens or pretend estrogens. These are the things I'm most interested in when I talk to people. So environmental, we use chelation, and we use various chelators for that, not just the EDTA, as you know, and you know and love that. We actually cut our teeth on that 20 years ago.
Yes, I remember.
But there are other chelators. Actually, vitamin C is a chelator in some substance. We use things like DMPS and other chelators. But again, that's a specific type of protocol for a specific problem that we're trying to help a patient with and improve their quality of life. Talk about having a poor quality of life. Wow. When you're exposed to these kinds of pollutants, even at a low level, lots of people who come in with some autoimmune issues, when we really seek it out and when we do the laboratory work, we find that they have exposures to certain types of toxins.
So what you're saying is it's not just, you mentioned that you were using this kind of cleaner,
right,
that really, really knocked you for a loop a little bit.
Yes.
And it's not just that. It seems like what you're saying, it's all over the place.
It's in everything. It's in our food. For example, our foods have persistent organic types of pollutants in it. We have pesticides, as I was telling you about. We have xenobiotics. We have plastics that do these kinds of things. And, of course, all the metals. In our water, what do we have? We have microorganisms. Again, bacteria is a pollutant. Viruses are a pollutant. Didn't we just spend the last 2.5 years talking about, and now we have a new one?
Yeah, right.
Right.
The disease of the month.
Yes. Yeah. Now, disinfectants, levels, organic chemicals. This means things that are organic in nature. Mold. That's another thing. I'm very interested in mold because mold, really, I've seen mold illnesses in our clinic extensively in New Jersey. It's interesting. It's very interesting.
What should people do, or what do you recommend they do, keeping in mind what you've just been telling us?
Well, one of the things is I think they should be on a healthy plan at home. You need to take some vitamins. You need to take some minerals, those kinds of things. But also, I think it behooves you to get some testing done to see where you fall. Because even if you are not in what they consider the danger zone, if something shows up in the blood work, let's say there's a low level lead in your blood, guess what? I want to get that out. Because no matter what, how low it is, it shouldn't be there, right? God didn't create us with lead in the, right?
Yes.
So these are the things I'm interested in. Even if your laboratory results come in below with what the FDA and CLIA, which is the clinical laboratory people federally, tell us is a danger zone, that's not good enough for me because I need to make sure our patients are at optimal level.
You've told me that you're a member. I know you're a member of an environmental medical group.
Right.
What does that do for you and your practice?
Well, actually,
what does it do for the patients?
Well, what it does for the patients is it helps me remember that this all has to be patient-centered in my approach. Again, each person's environmental exposure, it may be influencing their particular foundations of their healthy and living. So I always keep that in mind. But it also gives me access to a lot of research data, which I love because then it tells me, well, look, in this particular area, the farmers are all suffering from chronic lung conditions. Why? And then I read that there's a fertilizer out there that is doing this kind of thing. In fact, the people who are coming up are known to be farmers and carpenters and builders. and they really have many conditions. But it's interesting. They also suffer from many neurodegenerative conditions. And just this weekend, I went to look up their area on the environmental group, and I'll be darned, they are exposed to a lot of fluorocarbons, which are not good for us and can affect our thinking and that kind of stuff. Depression.
What are they, fluorocarbons?
Well, people, it's probably a pollutant in their water. Water. So, and it's allowed, up to a certain point is allowed. So again, what we have to do is realize that these pollutants can really be a driver in dysregulation in the neuroendocrine system and cellular malfunctioning, and that can make you have autoimmune type symptoms, whether it's sort of arthritic, but it all comes back, John, to one thing: inflammation. And the outside sources, nothing that you've done, knowingly to yourself, but these outside sources that have also caused your body to react in such a way that you have a high level of inflammation. And we know vitamin C and other chelators, depending on what I'm looking for, will help.
Your favorite question that I always ask you about the health food store, people are probably listening to this show saying, you know what, Dr. Molly's right. I'm going to go to the health food store and ask him for something as far as the environment is concerned.
Yeah, let me go in and get a bunch of chelators. Now, the question is, listen, folks, we have to use the right stuff. For example, iron. I see a lot of people who have hemochromatosis and these genetic high iron levels. Well, look, folks, you don't want to use vitamin C with that because there's a contraindication. But I sent someone, or someone actually went in. I didn't send them. They went to the health food store, and the health food store person told them, oh, yeah, let's get some vitamin C. No, never, none. So I want people to realize there's an art to this as well as a scientific basis to how you approach these chelators. And again, the other thing I want to say is, why do I love the hydration? I love the hydration because we can give you an amount of the chelator that we know will work without jeopardizing your kidneys and liver. And I'm big on that, John, because one thing I can tell you, sometimes going into the health food store, you can put yourself into toxic liver disease if you take the wrong thing.
And that's why you need some advice.
Amen.
And that's why you're there.
Well, also my wonderful nurse, she's on it. So between my doctor, myself, my doctors, and myself, and the nurses, we know what's out there, and we want to protect our patients at all costs.
All right, we are at the halfway point of the show. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Our number here in the studio, 855-839-1210. We still have plenty of time to take your calls. And like we always say, call now so we make sure we have plenty of time to talk to you rather than calling it. It's happened many times. Somebody calls at 2 minutes before 9. I'm about to go off. 855-839-1210 is the number, 855-839-1210. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia. I'm your host, John DeMasi. We both return. More Health Watch after these words. And we're back here on Health Watch. And as always, operators are standing by at Innovative Medical. And if you would like more information, and maybe you're a little bashful, you don't want to call the radio show, well, what you do is you contact the operators at 856-489-0505, 856-489-0505. And when you call, you get the information you want, and most importantly, you make an appointment to sit down with Dr. Molly. The initial consultation is complimentary, and that's where you really can find out a lot of the information as it relates to your particular medical challenge, whatever it happens to be. 856-489-0505. And remember, the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And again, our program is called Health Watch, and you'll find us here, the live version, every Sunday, 8 till 9 on Talk Radio 1210, WPHT. Our number here, if you have a question right now for Dr. Molly, 855-839-1210, 855-839-1210. You asked me during the break if I can pronounce this.
Yes, go ahead.
This is going to be a challenge. It's NAD,
right,
which stands for nicotinamide adenine dinucleotide.
You got it. That's my John. He's the linguist of this program, and I appreciate it. Listen, it is a very interesting thing because this has become a buzz in a lot of the spas and this kind of thing because of the critical role it plays in the mitochondria. And so they've taken that and it's used for anti-aging, among other things. However, there is true medical literature to show that this coenzyme really plays critical role in the mitochondria, which is the powerhouse of the cell. You hear me talk about that all the time. And it's a naturally occurring enzyme, which means it's a catalyst for other enzymes in the human cell. So it has a unique role in the ATP, which is our energy molecule, John. And I've got to tell you, this fuels all of our other cells. So you can see this is a framework for all our other cells. Now, I'm not against using it for anti-aging and making yourself look beautiful from the inside out. I think most of my patients do that who are on the NAD protocol. But I believe that you want to use this NAD in a way that really helps people with the damage that accumulates with DNA. And actually, when we talked earlier about environmental issues, NAD plays a very big role in keeping our bodies from that damage, from the damage to the mitochondria. So it really regulates every biological process in the body in terms of stress response, differentiation of cells, metabolic processing, and it's been shown to really have data showing that it works extremely well in cases of neuroendocrine issues. That also includes using it for people with addictions, and we actually have a particular program for addictions utilizing the NAD to reset the neuromitochondria. Now, we don't use it alone. That's the thing. A lot of these places are doing this, and they're throwing NAD at you. And, it's not a really thought-out protocol. But our protocol is very unique in that we've used it both for fighting against the free radicals and inflammation that you know about. It helps us fight. There's a different protocol for the environmental factors and pollution. We have another one for detoxification, whether that be from opioids and or alcohol. And we also have something that we used on the anti-aging side to help lengthen the telomeres. Now, this sort of, I'm telling people a whole lot of jargon today, but it's simple jargon.
Remember, you're the scientist.
Yeah,
so,
no, I'm trying to.
We're mere mortals.
No, I keep it simple. I do
I
that.
Know you do, yeah.
I don't like, I'm not a teacher in any way. I love to be on the bench, as they say. But here's the thing. The telomeres are the tails that are at the end of our DNA. And what happens is as we age, they get shorter and shorter and shorter. And there's relationships between those and getting to old age. Well, this NAD can help lengthen those. And I actually ran a telomere test on one of my patients, who, by the way, is a model patient. She comes in once a week. She's very big on antioxidants. She uses them. She has wonderful eating. She does nothing but organic and mostly plant-based. And I actually just ran her telomere test, and I actually fought her about doing it because I said, listen, why do you want to spend the money on that? It's sort of, what's it going to do for you? I just want to know. I said, okay, I'll do it for you. And I did. And guess what? She was 80% better than most people in their 70s. In other words, her telomeres were 80% longer than most people at 70.
You've been saying anti-aging, so I'm thinking, can I sign up for that, or am I
sure.
getting
Well,
that already?
John, here's the thing. I think first and foremost, you already have signed up for that.
Okay.
Just coming in the chair, and the fact that we're working on some of the comorbidities that also shorten our telomeres, right?
Yes.
Because again, what we're looking at is generic inflammation. And this whole thing about the ensuing damage from inflammation is really the cornerstone of everything we do. And that is what I'm trying to say. There's so much that goes into a process before we actually put your particular protocol together. because we know you're here. Most of my people are here for a reason. They're not here to just sit here and enjoy the hour or 2 hours that they're here. They're here because inflammation have brought them in the door. The question is, what's going on for that? Whether it's cancer supportive, neurodegenerative diseases, or autoimmune diseases. And when I look at this, when we use NAD, we're not just using that as a pure anti-aging to make your skin look good, because, we could do that, but we're really thinking that's secondary to effectuating the change of your metabolic problem.
I wanted to ask you, you were mentioning before the show, you were telling me a coenzyme that helps cells stress response.
Yes.
And how does it do that, and why is that important?
Well, it's very important. It's very, very important, because the stress response, the more stress we're under, the more inflammation occurs. So we have to look at we're really looking at the transfer of electrons. It's a little complex, but it's really simple. When we look at this, if we look at the free radicals again, and we've spoken about this, we need to make sure we start pairing them up. And what we have to do is we have to do that with the antioxidants, not just with the coenzymes, but with antioxidants. That's why it's important to use antioxidants along with the NAD in certain instances. So stress response can be very harmful, and it starts a whole cascading effect of inflammation in the brain. One of the other things, I'm very big right now on the neurodegenerative diseases, and we are using NAD in part of our protocols for some of this. And I'm using some regenerative medicine that I can go on at a later time. But it's really important that the cells in the body are extremely sensitive, and they will be permanently, prematurely aging in response to the inflammation from stress. So I guess that's it.
So this whole thing with NAD, and I know it's
complex.
It's complex. It's all over the internet, but
yeah.
How come, well, you're telling us about it.
Sure.
But how come we haven't heard more about it?
Well, I think it's being used a lot for, again, the skin and the anti-aging thing. But I think people, I would say physicians and scientists are looking at the true life-saving and life-extending use of NAD along with all the nutraceuticals. This is the thing. What we're finding is if you're in medicine today, the 21st century medicine that we do today, you'll find that we're looking at all of these particular things in terms of how do we utilize God's ingredients, which NAD is one, how do we utilize these to help a patient age more gracefully and actually prolong their quality of life. And I think therein lies the rub. I think most people are just throwing it up against the wall and saying, oh, look, we're going to improve your skin texture, whatever. I say we want to improve inside out.
Which is kind of what your practice is about.
You bet.
And has always been.
Right. I'm not just about saying, let's worry about the aging. Of course I am. I'm worried about preventing energy deficiencies in tissues that can cause disease states. That's what I'm looking to do. And I think more and more physicians and scientists that do what we do really want people to have more energy, function better, live longer, and improve their quality of life.
We are coming up on our final break of the morning, which means you still have time to jump in here with a question or a comment for Dr. Molly, 855-839-1210, 855-839-1210, a comment or a medical challenge or whatever it happens to be. We do have a couple open lines here, 855-839-1210. Our program is Health Watch, Sundays, the live version, 8 till 9, Talk Radio 1210, WPHT. With Dr. Molly Fantasia, I'm John DeMasi. We're coming back. More Health Watch after these words. Back here on Health Watch, again, operators are standing by, and they will be there well after we leave you at 9 o'clock at Innovative Medical Associates, 856-489-0505, 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. Like I said, they'll be there well after we leave you at 9 o'clock. Listen, they don't go home, all right? They're going to be there, and they'll be there all day. You think they're on the beach? No, they're standing by for you. 856-489-0505. And don't forget the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And also don't forget, if you miss any of today's show or you want to hear it again, we have our Health Watch replay this afternoon from 4 until 5 here on Talk Radio 1210 WPHT. And again, our show is Health Watch, and we're going to go to the phones right now. We're going to talk to Shirley in Lindenwold, New Jersey. Shirley, good morning. You're on Health Watch with Dr. Molly.
Hi, Shirley. How are you? How are you?
Fine, and you?
Good.
Dr. Molly, I have a question in reference to my sister-in-law. To make a long story short, she had a gallbladder stones removed.
Okay.
And she was in pain, so they went back and figured maybe they didn't get all the stones.
Right.
Then they went into the bile, cleaned out the bile. Now they can't move the gallbladder because her pancreas is swollen. And I want to tell the family to get her on some antioxidants, green tea, vitamin C, sunflower, clover.
Shirley,
So am I on the right path?
You could work in my office, girl. That's right. Tell her to get on some of this stuff. Her pancreas is now inflamed. Is that what you're saying at this point?
Yes.
Yeah. Listen, I've seen that before. In other words, when they go in, they start disturbing that whole area, and the pancreas is a wonderful organ. It keeps us going. You know that. The pancreas, and it's delicate. So I think you're absolutely right. I think she needs to get on some good stuff. I'll tell you, I would love to have her sitting in my chair as well. There are many things we can do. And it's interesting. Now, did they completely remove the gallbladder as well?
No, they can't remove
they
it.
They can't do it. That's right.
Down.
Right. All right. You know what? You are so right. She needs to get on clear liquids. She needs to rest that pancreas. And again, I can't give out medical advice, but these are the things I would tell my own sister. You are on it, girl. Get her on some vitamins and things and clear liquids, okay? God bless you.
Okay, thank you.
God bless
Shirley,
you.
thanks a lot for the
call.
call.
That was a nice call. And, it's interesting because many times this has happened. I've seen this happen before, and it ain't pleasant, as they say.
How about Shirley saying you should be on this and this?
Yeah,
and this?
I loved
and
it.
I was thinking, boy, is that Dr. Molly talking?
No. And, Shirley can give out the advice.
Exactly.
Dr. Molly can't.
That's
but
right.
I will say this. She's on it. And again, what's she doing? She's telling her to do things that are going to improve her quality of life.
Absolutely.
And there it is, folks. There it is.
Absolutely. 855-839-1210. That's our number here. We do have time for one or two more quick calls here if you want to jump in.
Sure.
855-839-1210. Talk about one of your docs. Her brother is in a pretty tough situation.
Yeah.
And I know you're treating him.
Right now, yeah.
What's the situation?
Dr. Pat's brother is also a patient. And it's interesting because Pat goes out and she'll tell everybody she has MS. But her brother has Parkinson's. Isn't that interesting? Because, traditionally you wouldn't think they're related. But obviously there's some genetic dysregulation there that's going on that affects their neuro situation. But it's different, He's been treating with us now for 3 weeks, and he has really, he's had some improvement. I wish I could say he had a tremendous miracle, but he hasn't. But he's feeling less fatigue. And interestingly enough, Pat says to me on Tuesday, hey, Molly, look at the way he's moving his muscles. Before, he couldn't turn his head. He would have to turn his body to speak to her. He turned his head to her, and she pointed it out to him. She said, hey, bro, do you see you turned your head to me? And he said, yeah, I didn't even think about it. And you may not think that's a big win, but it is a big win when you're locked into all the muscle spasm, et cetera, that you have with the Parkinson's and, again, with the tremors. And I want to say something. There's been a lot of data out there using one of the most wonderful nutraceuticals I have in my bag called glutathione for Parkinson's. And it was done, the studies were done years ago by Dr. Perlmutter, who everybody knows now for being on public television. But he did studies with glutathione and a way to deliver glutathione. And of course, Dr. Molly believes in those studies, and I've also enhanced them a bit with some synergistic things in his particular protocol. And we're using a form of regenerative medicine with him as well, keeping in mind that these are all, new developments and 21st century medicine, really.
The treatment so far.
He's had 3 weeks of treatment.
Now,
right
does it continue, or what happens?
Sure. As Dr. Pat always says, listen, he may have to be a lifer because he's not as far as we've gotten with Dr. Pat, who's actually taken all these treatments now. She's been with me for 3 years?
Yes.
Right? And she takes a treatment at least once a week. She tries her best not to miss because she has seen the improvement it's done with MS. Another thing that's interesting, I always talk about a subclinical dose of a traditional medication. Well, I've just finished reading 2 volumes on this that have just come out last year and this year, showing how much this medication has helped people with neurodegenerative diseases, also with things like depression and some other, and cancer support. So again, utilizing this in some of the protocols that we've developed, meaning my physicians and myself, that we've developed in our clinic has really made a difference in the quality of life for people with these neurodegenerative diseases.
All right, we've got a couple of minutes left of the show, and I know you wanted to talk about, and I actually know this patient. I've seen she comes in the same days that I do.
Oh, the
ALS patient.
Yeah,
what's the situation
there?
Well,
here it is. This is a very difficult case, and again, this is experimental, as they like to say, because we don't know how all of this stuff will react with her. But her husband purports to me that he sees after 10 treatments, he has seen a difference in her. Now, she is a very unique patient in that some of the challenges with the ALS are some additional things that develop. It's not just the muscular impairment, but she also has some to overcome some thoughts that go into the mind, like she doesn't want to get an injection, and she doesn't want to get an injection that we usually give at the end of the hydration. But it's interesting to me because we actually had a pretty profound dialogue on Thursday, which I was surprised about. I sat with them for 15 minutes, and she said, see, I just have had enough. And I said, I know you feel that way, but can you take it from other people that they're seeing improvement? Yes, but it's just not enough for me. And that's the thing we're always overcoming with these conditions. It's how the patient is feeling. I mean, can you imagine the frustration of being stuck in your mind and not in your body? So I'm very cognizant of this, and my people are, and we really try to help patients realize that this may be slow and methodical, but if we can get even a 20% increase in what she's able to do and what she's able to express, that's a big win for someone like her.
I guess it's hard to see when you're in it.
Exactly.
But I've seen her, and she's actually talked to me. And I've seen her. She's talked to other patients. She commented on somebody's shoes one day.
Yes.
So you see she's trying to be normal.
Right. And that was something she didn't do in the beginning. She used to want to go in a private room.
Right. Yeah,
but now we've got,
that.
And what we've done is we realized that it's the help of the companionship of people in the clinic also that help her, because socialization is very important. We know mind, body, spirit, man. We know it. So we try to live by that.
And with that, we put the wraps on another edition of Health Watch. Don't forget, operators standing by, and they'll be there well after we leave you at 9 o'clock this morning. They'll be there all day. 856-489-0505, 856-489-0505. That is the number. And don't forget, check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And one more thing, our Health Watch replay this afternoon from 4 until 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Catherine, and Jess, and of course also fabulous Fran, delightful Dee, Joanne, and our medical assistant, caring Kathy. I'm your host, John DeMasi. Thanks for listening. Have a great week and a healthy one. We'll do it all over again next Sunday, the live version, 8 till 9. Health Watch, Talk Radio 1210, WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.